So we're going to move into kind of our nursing hat at this point. Um, Generally, every morning, Stacy's going to wake up and open her tablet, her computer, to get her schedule for today. Today, she just has the one visit. And at that point, she can go into travel mode, and that allows her to kind of go put a computer in her car and travel around and just take care of the things she has to do outside of the office that day. So in this case, it's kind of a dashboard designed for people who are out of the office. So it tells me what the weather is, how many events I have today. In this case, our care validator has turned a visit back to Stacy, a visit she did on the 21st. So she can go in and fix that visit or see whatever problems are associated with that visit. She has some mapping capabilities. And she has the visit that she's supposed to do this afternoon for Tony Smith. So a few options that she has there is she can pull up a map of Tony's house. She can get phone information, and she can also send a message to say that she's running late or that she needs to reschedule the visit, or just a custom message that can go back to the case manager or to the patient. Once she gets out to the patient's home, she's just going to click the begin visit. And I guess that gives me a good chance to show how to set up your service codes. So let's skip back to that. We'll go to company settings. That's under our list setting and our products and services. Let's look up that adult RN eval. It is a service that's sold to clients. Under income, we're going to say that it has a default HCPCS code of G0166. And we will say that the form we want is the skilled nursing form. We do want it to go to care validation. We want it to be confirmed whenever it's complete. So we'll go ahead and set that up. Now, whenever Stacy goes to do her visit from travel mode, it pulls up our skilled nursing evaluation visit. So this is our point of care program at this point. I have my patient information kind of at my fingertips. I have prior medical records, which of course there aren't any because this is our eval visit. We have their medication profile. We have any files that have been attached to this visit, any additional notes we want to attach to this visit, a printout of the way the visit will look when we print it to paper. So now that I'm going into the patient's home, I'm just going to click this Start Visit option and say it's an assessment. Are there any other documents that I want to complete? The system will check some of these based upon our payer and the patient requirements, but you can manually override those if needed. The time that we started the visit, how far we drove, how long that took us to drive, and then we just hit the save section. And you'll notice that the section turns green, and based upon the type of visit that I'm performing, we'll get a bunch of other clinical information. So now I can just move down through my documentation. Since this is an eval visit, we're asking for our admission documents, which would have been set up underneath the office settings. My patient can go ahead and sign off on their admit documents through the software. And we'd move on to meeting the patient. Won't run through all of the point of care options, but I will mention some that may be a little confusing. One of the nice things is that you will see the system was designed to work on a tablet with using kind of finger touch inputs. And it's also designed to be really easy to use. So you'll notice the sliders automatically change color based upon the level of deficiency for the patient. So as you're working, rather than having to read through each individual field label, the system makes it very easy to track by a color code. You'll notice that a lot of these fields correlate to your OASIS questions. As a matter of fact, you will notice that these OASIS questions, if you click the OASIS button, are automatically populated for you based upon the answers that you're giving here. So you do want to review those, and you'll have an option to review those at the end of the visit as well. So it's completely integrated into the system. Then we look at patients' demographic information, health history, where we walk you through quick wizards, so you only have to fill out the information as it's applicable to your patient, making it about as simple as possible to complete your documentation. Risk factors, diagnosis codes, we do keep these lists up to date for you. Simple to search through those options, onset or exacerbation, diagnosis dates, and whether it's the primary diagnosis for that patient or the billing diagnosis for that patient. Procedures and comorbidities and inpatient history. So I'll let you guys look at those kind of at your leisure if you do nursing functionality. I'll just briefly skip through and see if there's anything that needs additional information. So all of your vital sign statistics. After you set up your plan of care with vital sign parameters, we will notify you if any of your vital signs are out of parameter. And just like before, we only ask you additional questions if there are irregularities. So it makes it very simple for you to move through the system, only answering the questions that are applicable to that particular patient. You have multiple pain scales built into the system with scoring capabilities, allergies, your medication profile. Again, we do have the Lexicomp database automatically built in, so you can key in your medications using a quick medication search. The system will tag those. You can set the risk factor associated with it, the frequency, and for some drugs, who's going to administer those drugs, where they're located, where they're stored, and notes that could go onto the plan of care if you would like us to flag them for you. And then you also have the capability of doing a medication review to say if there are any drug interactions or contraindications, with an ability to sign off on that and to keep a review history. All of that's handled directly by the software. Of course, you can also set the pharmacy for the patient, track their drug regimen, neurological conditions with depression screening, Integ options with some really advanced wound care options available to you, your Braden and Norton scales for skin integrity and pressure ulcers, automatic scoring of those, mobility indicators with the timed up and go, the pediatric and the Missouri assessments automatically built in. GI and GU, so diet information. All of this will the applicable information will transfer over to your plan of care automatically. Urinary and incontinent information, ostomy information, equipment and supplies categorized by the body system as necessary, respiratory equipment, tracheostomy, ventilators. And for ventilators, you do have the capability of creating a ventilator flow sheet along with your standard flow sheet settings, nebulizer, oxygen, cough assist, etc. And then just the ability to utilize your own DME and supply list as well. A full risk assessment which again goes to your plan of care, activities permitted, functional limits, risk for hospitalization, abuse or neglect indicators, DNR status, and triage information. Once we get to our progress toward goals section, since this is our evaluation and we haven't set up a care path yet, the system will prompt us to go ahead and create a care path. You can just click the link there. The way that works is based upon the problems that the patient has, which are listed out according to body system. We just simply say, okay, the patient has chest pain, diabetes, maybe they have nutrition deficits. Based upon those problems, our next step is going to be establishing goals for those particular deficiencies. So we want to add in goals. We have two options there. We can add in a custom goal, which just allows us to type in our goal here. You can state whether that's a short-term or a long-term goal, or if it's a patient-specific, patient-requested goal. Start and end dates you can set if you'd like, otherwise it runs concurrent with the episode. You also have the option of adding goals from a list, and this is your own custom list. So you can create these lists underneath your company settings, custom problem list. So you'll have some of these in there by default, but you definitely will want to create some default care plans within the system so that you can just simply choose from the list to have those completed. And then in a similar manner, after we've established our goals, we will create interventions to help us meet those goals. Same way, we can add from a list. So maybe we want to do a cardiac skilled observation and assessment, teach on chest pain, maybe we want to monitor their pulse ox. In any of our procedures, you're able to control how often you're going to do that. So in this case, we want to monitor their pulse ox one time every visit. So that gets created. You can always click on the edit button to update that particular intervention to make it more customized to the particular patient. And then you'll just hit add. From that point on, every time you do a visit, all of your goals will be listed out under the Progress Toward Goals section, so that you can simply say we worked on this goal today and the patient is progressing, or they're not progressing, or they've met their goal, along with additional documentation. So it allows you to very quickly document progress toward goals as well as any interventions that were performed on this visit. So in this case, maybe we monitor our pulse ox, and it was done according to protocol at 3:52 in the afternoon. At the very end, we have the ability to create additional documents. Most of you will see this project link with the title Plan of Care. We have custom terminology turned on right now. But you will most likely want to go ahead and create a plan of care for your patient when you do your evaluation. That plan of care section is it automatically takes into account the care path that we created earlier. So those will show up. You can click on the care path items screen to go ahead and set your frequencies. So for instance, nursing, we can look at a calendar. First I need to put in our plan of care dates. So let's go ahead and set that up for the 15th. I want this to be a 60-day episode. The physician, a lot of this will default if we would have created it on the patient screen or completed it during our point of care visit. Calling it our verbal order, start of care date, who we're going to assign the overall care plan to. We can the system will automatically track the sent date of our orders. Our diagnosis codes, our health status information would have pulled in from our visit automatically, and then we get our care plan information. So I can just document when I want to make those visits, and the system will automatically create frequencies for me. So you'll notice it's given me a frequency of 1 visit for the first week, 2 visits for the second week, 2 visits for the third week. Whenever I submit that, you'll notice that the system automatically creates my frequencies for me, even though they're very complex. So this actually will read out 1 week 1, 2 week 2, 3 week 1, 1 week 1. So you have some really advanced options for scheduling. And you can also just manually add those in. If you don't want to use the calendar option, you can just simply say we want to do 1 visit or hour per day, week, month, or episode for however many days, weeks, or months. So very, very comprehensive calendaring system built in. For your Medicare agencies, you have your physician certification statement or need for home care, discharge planning, some of the new COP requirements, as well as some common items that you may want to put on the plan of care, like being able to place services on hold until an authorization is obtained or when the patient is out of town. You may want to set up your vital sign parameters, so to notify the patient or the physician when a patient's pain level is above a 7 or when their temperature is above 100. Those will automatically flow into your next visits. You can also track your patient's strengths, care preferences, send a note to your scheduler, even set up a budget for this particular plan of care. And that allows you to finish out the plan of care, communicate it to the patient or to a representative, electronically sign that plan of care, and go ahead and save it in the system. You'll notice that the plan of care has been created and gives us the capability of editing that plan of care back on our visit note. You can create an aid care plan, a physician's order, an authorization request if the insurance company requires that. You can create a separate communication note. You can create a separate incident report. You can create a separate discharge summary if this was a discharge document, or a transfer summary, a supervision form, or a missed visit document. All of that's available kind of at your fingertips. And at the very end of our point of care visit, we can go ahead and capture our patient signature and turn say who it was signed by. Our nurse or therapist can sign off on their documentation, and then we can say who we turn the care back over to, the patient or to a caregiver, the date and time of the visit, and based upon that timeout, let's go ahead and set it. System will track that for us. We can complete a care coordination note. And when we're all done, we just hit save and submit. The system will do a complete validation for us, so you can see all of these areas of concern that I've not completed. The system's not going to let me turn in my visit note until all of the errors are completed. All the ones in yellow are warnings, and so I have to have at least all of these red errors completed before I can turn the note in. I also have the capability of doing my OASIS review, seeing all of the fields that were completed when I did my evaluation, scoring my PPS information. If I had completed this document, it would give me my episode payment and my total payment, so I could go and do some financial calculations as well.